this point, and this is all in the setting of advanced kidney cancer, and just to maybe narrow the discussion a little bit, specifically clear cell, which is the most common histology, I'd say for most patients now, I would favor an initial approach with immunotherapy. And the reason is a couple-fold. One is certainly for patients who have, when we look at the risks of how aggressive the kidney cancer is, and we bucket them into intermediate risk or more aggressive or poor risk, those patients definitely benefit from immune-based therapy, and there's no doubt about it. The question is only, which is being discussed in the session right now, is patients who have the more favorable risk, is immune therapy beneficial in that setting? And I think my preference would generally be yes, even in that setting. And I think as we follow out data longer and longer term, we're seeing one, that they don't do worse, which is important, but I think the other important thing is there's probably, again, a subset of those patients who will truly have a long-term durable response, which I think would be much, much, much less common with anti-angiogenic therapy alone. And so I think, for me, certainly in any sort of aggressive disease, that is a definite, but even for patients with a slightly more indolent disease, with more favorable risk disease, I think there's a strong argument to be made for immune therapy up front.